Hi everyone, my name is Jaron Clyde. I will be talking about the treatment, prevention, and additional information about herpes simplex 1. So currently there are no vaccines for herpes simplex 1. Um, Researchers have been laboring for years to come up with herpes simplex virus vaccines, but we don't have any yet. A very important part of managing the herpes simplex virus is recognizing it and treating it early. It can be recognized by the signs and symptoms previously discussed by the other members of my group. Both primary and reactivated infections with herpes simplex 1 are treated with the same specific antivirals, but the chronicity determines the dosage and also the frequency that the dosage is given. Initial infections are treated with higher dosages and more intense frequencies. Episodic therapy for herpes simplex 1 infection includes antivirals at higher doses, usually multiple times per day. It can also include topical viral suppressants like, and I don't know if I'm saying this right, docosanol cream, also known as Abreva, applied 5 times per day for up to 10 days. I also read about the amino acid lysine being used to inhibit the replication of HSV1, although I wasn't able to determine if that's a recommended treatment. Suppressive therapy for the disease includes lower dosages of antivirals once or twice per day. The whole goal of these drug treatments is to prevent morbidity and other complications of the disease. Hopefully in the future we will be able to destroy the virus instead of just treating it and suppressing it temporarily. The side effects of these antivirals with acyclovir, for example, a common antiviral therapy. This treatment is hard on kidneys. It may also cause malaise, nausea, headache, diarrhea, or vomiting. There are also other rare but serious side effects. So general care for the wound. Adequate hydration is important during treatment, especially during antiviral therapy. General wound care should be maintained to avoid the risk of secondary bacterial infections. Keeping the wound from drying out can prevent cracking and splitting, which is painful and can increase the chance of secondary infection. Keeping the wound clean with soap and water will help this as well. Anesthetic gels, non-steroidal anti-inflammatory drugs, and Tylenol can be given to treat pain. Home remedies include ice packs and baking soda to soothe the pain. For prevention, it's important to avoid sharing toothbrushes, drinks, food, kisses, towels, and other things through which the virus can be passed with people who have the cold sore, who have this virus. Now obviously we can't avoid all these things all the time, but if someone has an active sore, we can do our best to avoid sharing a drink or something of that nature with them. Additional information, epidemiology, rates of HSV1 infection for low socioeconomic areas are 70 to 80%, while they are 40 to 60% in higher socioeconomic areas. 57.7% of the population of the United States is infected with HSV1, although the majority of them are asymptomatic. This is an interesting little bit. Duke University is taking a different approach to HSV. They said unless you can activate the virus, you can't kill it. So they are working on overriding the microRNA that keeps the virus in its latent state, and in theory you could activate all the virus at once, and once it's alive you could kill all of it for good. The person would have to have one last terrible cold sore, but then that would be the end of their cold sores. So now I'm going to turn the time over to Laura Knight, who is in our group, and she will tell a brief story about her experience with HSV1. Thanks.